Hi everyone, my name is Jessica and today I will be talking about my research critique, which is on managing cardiovascular risks with Tai Chi in patients with coronary artery disease. Tai Chi has been introduced to healthcare professionals in order to help promote cardiovascular functioning and increase quality of life in patients with coronary artery disease. Coronary artery disease is a chronic condition that requires individuals to adopt to certain lifestyle changes. However, patient participation, especially in those with coronary artery disease, has been low due to lack of motivation, high costs, and limited accessibility to health programs. This problem is significant to nursing because coronary artery death rates are expected to rise within the next 2 decades, and this can be prevented if effective measures are applied to help reduce certain risk factors that contribute to coronary artery disease. Program interventions that can help aid in the process of reducing coronary artery disease are smoking cessation, diet, exercise, Tai Chi, such as Tai Chi, stress management, and behavioral modifications. Such interventions have been proven useful in promoting favorable outcomes and helping reduce morbidity and mortality in patients with coronary artery disease. The purpose of this study was to implement Tai Chi exercise, nutritional education, and stress management as a cardiovascular risk management program. Another purpose was to assess whether the effects of Tai Chi would be beneficial to patients with coronary artery disease. And lastly, to determine whether Tai Chi alone would be more beneficial than Tai Chi with nutrition and stress management and education classes. The study that was used in order to conduct this study was a quasi-experimental design with a non-equivalent control group. So what kind of design is this? Well, it's a design that the outcome is predicted by theory and through research. The framework that the researchers used to conduct this study was the health promotion model. The intervention that was implemented was the Tai Chi exercise alone and Tai Chi with nutrition, education, and stress management classes. The variables in the study were both independent and dependent variables. The independent variable is the cardiovascular risk management program that consisted of the Tai Chi exercise program with and without exercise and nutrition and stress management classes. The dependent variable was cardiovascular patients with coronary artery disease. The method that was used to conduct this study was a convenience non-random sampling method, which consisted of 117 participants in which researchers allowed them to participate to choose which intervention group that best suited them. The researchers felt that by doing this, that it would help enhance patient participation in this study. So, who was included in the study? Well, the 117 participants with coronary artery disease aged 53 to 75 that were recruited by their PCPs. The patients had to have had no cardiac surgeries within that 6-month time frame and had to be literate in order to understand questionnaires and educational classes. Individuals that were excluded from the study were, of course, individuals who were illiterate, who had cardiac surgeries within that 6-month time frame, and who had any previous history of any form of a formal exercise or nutritional program. Researchers used a 3.0 G power with an alpha of 0.05 in order to estimate their sample size. The estimated potential attrition rate was 25 to 30%. So this indicated that the method needed about 100 participants in order to conduct this study. The program was conducted with certified instructors, where Tai Chi classes were offered once a week for 60 minutes, along with required home exercises for 30 minutes 3 times a week. Nutrition classes were also offered for the first week of each month, lasting 1 hour, and lastly, stress management classes during the 3rd week of each month, also lasting 1 hour. Attendance at each class was documented. Data was collected using 3 measurements. The 3 measurements were the Cardiac Health Behavioral Scale, the Short Form Health Survey, and the Korean version of SF36V2. An analysis of covariance along with chi-square tests were used to compare outcome variables with pretest variables. Data was measured before and after the 6-month time frame, and scores for modifiable cardiovascular risk management programs risk factors, included age, family history, cholesterol, glucose, systolic blood pressures, obesity, medical conditions, exercise, stress, and smoking. All data were analyzed using the SPSS for Windows version of 15.0 software. The study was supported by the Chungnam National University Hospital Research Fund in 2005 and was approved by the Ethics Committee. In addition, all data was collected, protected, encoded, and analyzed on a computer that only was accessible to the researchers and was locked with a password. Results of the study showed that both Tai Chi interventions were effective. However, the Tai Chi with education was more effective than the Tai Chi only group. Researchers found significant improvements in systolic blood pressures in both groups, where most of the participants had hypertension and coronary artery disease. Systolic blood pressure readings in both groups were significantly lower at the 6-month time frame, and the participants also reported having improved mentally, emotionally, and increased quality of care, which was very beneficial to the individuals in this study. However, there were no changes in cholesterol levels because more intense exercises were needed in order to reduce these changes. There were limitations also that were found in the study. Such limitations were, number one, it was offered during an inconvenient time, which was on Sunday mornings, and which made it very difficult for women to participate in this study because they were expected to be at home attending their family members at this time. Another limitation of the study was the differences in gender roles, because more men were in the Tai Chi with education group than the other group. Another limitation was the dropout rate of 27%, which could have been possibly because of cultural differences or gender roles. And lastly, the randomization size, which consisted of only 117 participants. It can be applied to nursing because evidence indicates that Tai Chi can be offered in combination with nutrition and stress management in education classes. It can also manage cardiovascular risks and improve quality of life in patients with coronary artery disease. And if you can find ways in order to help improve patient motivation, we can have more sufficient outcomes, with patients who have coronary artery disease. In conclusion, Tai Chi with exercise, stress management, and nutrition education has been proven as an effective intervention. Coronary artery disease is preventable if effective and proper interventions are applied in order to reduce these risk factors. Lastly, further research can be done in order to find out if Tai Chi can also increase quality of life and reduce risk factors in other chronic diseases and conditions. Thank you very much.